Hello, great people. Education is power. Knowledge dissemination is very important for successful farming activity. Thank you and welcome. Today we are going to discuss about poultry infection that we call fowl pox. It's a very common disease that is available that attacks chicken all over the world. The epidemiology spreads across the world. Fowlpox is a highly contagious viral infection in poultry that causes painful sores on chicken skin. It's also referred to as chicken pox, sorehead, or avian pox. Chicken pox is unrelated to human chicken pox and cannot be contracted by people from the chicken. The disease has no cure. Chickenpox appears or manifests itself in two different forms: the dry fall chickenpox and the wet dry chickenpox or fallpox. Under the subtitle dry fallpox and wet fallpox, I'm going to discuss that is the dry fallpox, which is a viral infection that affects a poultry or chicken skin in non-feathered areas, most commonly the comb, the wattle, the face, and the eyelids. This disease it affects the non-feathered areas. Dry fowl pox, presents itself or manifests itself as ash-colored relations on the comb, the face, and the wattle. On the other hand, the wet fowl pox affects birds' upper respiratory system, the eyes, the mouth, the throat, and is life-threatening. The disease is spread when a susceptible hen comes across an infected hen with wounds on the skin. When now they become in contact with the affected, comes in contact with the uninfected, it can spread. Also, when an infected bird comes into contact with the mucous membrane of an infected bird, then it also spreads. Also, number three, the infection can spread via ingestion of the debris, the scabs. Also, another method by which the disease is transmitted is by biting insects. Most commonly, the mosquitoes. They spread this disease to the chicken. The disease is highly contagious and spreads slowly from one hen to another and can affect the entire flock over time if there is no control that is taken into consideration. The disease can be in the flock or can persist within the flock for a long period of time if there is no proper control, there is no proper way of eliminating the disease. That is, you have to make sure that there is efficient measures, oxytetracyclines, and also you ensure biosecurity measures that are at high alert. Now we are at the most common question that farmers do ask us as animal health practitioners or veterinarians in the field of animal health and who are concerned with the productivity of our farmers to ensure that we have food security. Number one is that there is ash-colored lesions on the comb, the face, and the wattle. Point number two, or clinical sign number two, is there is bristles which enlarge to yellow bumps and finally or eventually become dark colored warts looking like scabs. Number three, the scabs eventually evolve, leaving scars behind. The point number two is explained, or the final effect of point number two is the one that comes down here. Now, when the poultry or the hen has healed, there are scars that are left behind. Some chicken acquire immunity, but others may experience recurrence of the disease depending on their health and stress times. For layers, there is drop in egg production. There is also loss of appetite, which result to loss of weight in the animals, in the chicken. Another point is that there are lesions in the mouth and in the throat for wet fowl pox. Uh, and also for the dry fowl pox, there are lesions on the face, the wattle, the dry and generally the skin of the hen. After the farmer, you have seen all these clinical signs in your poultry and you've gotten the necessary medication and you given to your hens. Now, there is a reason as to why you should always try to make sure that the same problem does not recur in your farm. What are these things that you have to consider? Number one, and the prevention and control of the fowlpox disease. Number one, ensure good biosecurity practice measures. By good biosecurity measures is that you ensure that the entrance to the poultry production unit is has a footpath, is well fenced. There is good control of movement in and out. There is proper waste disposal. Those are very, very important things that as a farmer you should look into. Number two, you should ensure that you have excellent quarantine measures for newly bought flock of chicken. You have to quarantine them for at least 1 month to ensure that they are free of any disease. Number three, you ensure that you control the insects. These insects, i.e., the mosquitoes, are the carriers, are the vectors, the carriers in they are the vectors, they have the virus. So you ensure that you control them very well. Another point is vaccinate all the healthy chicken. Ensure that you conduct pox vaccination. It is very, very important. It will help you reduce on the chances of losing your poultry. Economically, it will help you because when the chicken get sick, there is loss of production. Now, if you vaccinate at the right age, you going to get the proper production. The poultry will not get sick. It's very, very important for you as a farmer to vaccinate. Also, during an outbreak, you ensure that you ensure that you provide clean, sanitized waterers. You ensure that the waterers that you're giving your poultry with water, they have to be cleaned, they have to be sanitized so that they are safe. And also, in the drinking water, add some iodine. eh? Add some iodine in the water. It's very important. It helps to help the side the in wet fallpox. It's very important. It helps to heal those lesions. Farmers, for your information, for you, it is very important for you to know this. Fallpox has no treatment. Once the disease has affected your poultry, you do what we call you treat your poultry with the oxytetracycline, ensure that the environment is well. So on treatment of this disease, the unaffected birds, number one, you vaccinate all of them. Number two, you over oxytetracyclines, antibiotics, in water to control any secondary bacteria which may cause infections. Remember, this disease causes lesions. Now, when there are lesions, the other parasites, the bacteria may take advantage and invade those lesions. When they have invaded the lesions, then you're going to have another problems in the health problems, another disease occurs. So it's very important to give oxytetracyclines. And number three, treat the scabs with dilute iodine solution. Dilute iodine solution is used to kill, you kill all the bacteria that may have been been the hen has been exposed to. It's very important. Number four, apply ointment to soft scabs, i.e., mix 2 spoonfuls of sulfur powder with half cup of Vaseline and apply gently on the lesion until the lesion is healed. Number 5, mix dilute iodine solution in flock drinking water. This point, when you mix iodine solution in the drinking water, which should be clean and free of contamination, it helps to heal the wet fall pox. Thank you very much, dear farmers. I hope this information is going to be very pivotal in the effort of making sure that we have a productive farming practices. In case of you want a suggestion on what we should discuss next,